helping make your life easier. Moms Every Day.
Hey everyone, welcome to Moms Every Day. I'm Amy Parker, and today we're chatting with Dr. Philip Wilson, who's the medical physician here at Regenerative Medicine of Alabama. Thanks for joining us.
Thank you.
Now, in addition to treating chronic and severe joint pain, y'all also cater to men's wellness.
That's right. We offer some treatment options for sometimes what can be a difficult subject for men to talk about, but erectile dysfunction is probably more prevalent than you would think. It affects roughly 40% of men age 40, 50% of men age 50, 60 at 60, and up to 70% of men age 70 and above. The other side of this is men as young as 30, they may not have true dysfunction, but sometimes they've noticed their performance is not what it once was and could benefit for some treatment to help improve this. It can lead to a significant impact on their quality of life in terms of their relationships.
Sure, absolutely. What kind of treatments are available for that?
Well, our physician assistant and I are both trained and certified in the Gaines wave procedure. This is a type of technology that uses sound waves to help break up plaques in vessels in the affected area, and ultimately it leads to increased blood flow and increased sexual performance.
Now, it's a topic that a lot of people are uncomfortable talking about, but people can just call and make an appointment to...
Right. We have, a couple of different techniques that we can use. We also provide what's called the P shot for men, and even the O shot if women are having any issues with sexual dysfunction. This is a type of treatment that we also, as you mentioned before, we use for the treatment of joint pains. It's widely used in regenerative medicine. And the fact is that here at Regenerative Medicine of Alabama, we've got several options. They're proven to help improve patients' quality of life. If anyone's interested, we encourage them to come in for a consultation to see if they'll be appropriate for these treatments.
Good deal. Thanks for sharing, y'all. Thanks for watching. We'll see you next time.
You may not know this, but 1/3 of the world's adult male population has experienced erectile dysfunction. So there's a firm basis for the phrase, "Don't worry, this happens to lots of guys." What's even more amazing is that when things don't quite stand to attention like they once did, most of those men won't seek help or advice. When it comes to physical intimacy, erectile dysfunction can really throw a spanner in the works. It naturally creates stress, embarrassment, and in some cases can even lead to anxiety and depression. You'll likely be familiar with a few treatment options, but if you cannot or do not want to take non-essential medication, or if you feel that a pump goes some way to deflating the spontaneity of sex, then you'll likely find the next 60 seconds very interesting. There are a number of factors that can contribute to problems with impotency, including high blood pressure or cholesterol, diabetes, heart disease, being overweight or lacking physical exercise, and being over a certain age, although it can happen at any age. A lack of stiffness downstairs often stems from two physical causes. One is a restriction of blood flow into the vessels needed to create an erection, and two is a lack of tension that results in the blood escaping back into the body. Extracorporeal shockwave therapy, or ESWT, is a therapy in which short pulses of focused shockwaves with a very low intensity are directed at the penis. New blood vessels are formed, which might help to increase blood flow, and this may also result in an improved ability to get and maintain an erection. The therapy consists of several sessions and can be repeated if necessary. More and more men are pointing towards shockwave as a solution to vascular erectile dysfunction, and there's a lot to like about the treatment. It has no downtime and comes with virtually no risks or side effects. It's a clinically proven treatment, with each session only taking 15 minutes, and it's totally non-invasive. But most importantly, it's completely drug-free. While results may vary, typically patients will notice some change within the first few weeks of starting treatment, but with the most significant changes occurring around the first month. You may be interested to know that shockwaves can also be used as a treatment option for Peyronie's disease and chronic pelvic pain syndrome.
I'm Dr. Paul Thompson. Over the past 30 years as a urologist, I've helped thousands of men restore their sexual health by improving blood flow. Shockwave therapy has proven to be one of the most powerful and effective solutions for men. Let's look at how an erection works. This is a cross-section of the penis, including the network of blood vessels and the soft, spongy tissue that hardens, called the corpus cavernosa. When you become aroused, your brain sends a message to your penis. In younger, healthy men, blood rushes in through the network of blood vessels to fill the soft tissue, causing the corpus cavernosa to expand and become rock hard. Unfortunately, as men age, the network of blood vessels in the penis becomes clogged with plaque. This means less blood flow where it counts. Tissue health declines due to a lack of oxygen and nutrients. Unhealthy tissue and poor blood flow means guys have difficulty performing in bed like they could when they were younger. To help with this natural part of aging, doctors began prescribing pills in the 1990s. The main problem with pills is that just like a Band-Aid, they don't actually fix anything. They just mask the symptoms. And once the pill wears off, men are right back to where they started. Instead of a lifetime of pills with tough side effects, guys deserve a solution. Sound waves called shock waves to safely treat the plaque that's getting in the way of good blood flow. These same shock waves travel deep into the tissue, causing microtrauma. It doesn't hurt, but it's enough to get the body to respond by growing new blood vessels, delivering stem cells and vital nutrients to help tissue recover.
The P-shot is an advancement in the treatment of erectile dysfunction. Let's go over a quick little review about erectile dysfunction and how does this P-shot actually work. So, first and foremost, erectile dysfunction is going to be all about blood flow, the blood flow. So, and whenever you're having the blood flow in the penis that helps with the erections, you kind of think of three things. You got your heart, your cardiovascular system, you got your mind, your mental stimulation, as well as the hormones. All of those things are going to come into play into how well your erections are actually performing. Now, in terms of the P-shot, well, how does this work? So essentially, what the P-shot is doing, it is increasing the vascular response inside of the penis tissue. It's anti-aging for the penis. It's actually anti-aging for the blood vessels in that area. So how cool is that now we have a procedure that can actually help to regrow and regenerate the tissue in that area. What we do is we take the blood out of your body and we do something that's called PRP, platelet-rich plasma. And essentially what platelet-rich plasma does is we isolate growth factors from your blood. Growth factors, what do these do? They help to regenerate tissue. Now there's many growth factors that are in there. So that's really a good thing about this, is that it's your own body and you have multiple growth factors. I like to call them little robots that go in there and repair your body. And it's your own body repairing your own body, which is really amazing. Now, how does this work? So we take this PRP, we extract the blood from your body, we process it in these special FDA approved machines that isolate the blood work, all in complete sterile conditions. And when we actually do the procedure in the office, it's short, it's only about 15 minutes. You're usually at the office a little bit longer than that because we need to prepare your blood, prep it, side effects, right? So guys are always gonna say, well, what are the side effects associated with it? The cool thing about it is that there really aren't very many side effects. Why aren't there so many side effects? Is because it's your own body, it's your own cells. That's one of the best things about this. So if you are going to have any side effects, some guys might have a little bit of tenderness after the procedure, but that tenderness does go away, and some of them may actually get a little bit of bruising from whenever we actually do the procedure. But again, the bruising does repair itself. So the other good benefits, side effects, are better erections, better penis health. The procedure is still going to last you about 12 to 18 months, and some men actually increase the size of their penis. We have about 40% of the men that are going to report about a 20% increase in the length and the girth. So this isn't, again, for everybody. The procedure is primarily for erectile dysfunction, so your erections work better. But this is a side effect that some guys actually do experience, so that's actually a good thing.
We were friends, you're the friend that I love the most. We were friends, you were all so good to me. We were friends, it was you that I'd always boast. We were friends, we were best friends indeed. That's why I say to you, I wish you'd laugh again and sing aloud like you used to do. But you don't call me now or drop around. I want you to. We'd fly away up high above.